Hi everyone, my name is Megan Pankratz, and today I'm going to be talking about folate and cancer. So thank you all for coming. And right away, I'm just going to start off by talking about what cancer is and some of the background information regarding cancer. So cancer refers to any one of a large number of diseases characterized by the development of abnormal cells that divide uncontrollably and have the ability to infiltrate and destroy normal body tissue. So everyone here has probably heard of various different types of cancer, such as colon cancer, breast cancer, prostate cancer. You can have cancer of many different areas of your body, and cancer is a very, very hard disease to live with, and oftentimes it can really impact your life. Cancer can spread through the body, as we discussed earlier, and unfortunately, cancer is the second leading cause of death in the world. But however, there is some good things coming with that, is that survival rates are improving for many different types of cancer. Now, this is because we now have more adapt screening tools and prevention tools and treatment. So with science growing, we also have good things coming out of it, and we have a better ability to really prevent cancer and also just screen for it sooner. So as you know, you have probably seen over the last couple of years, there's different screenings you can do, such as an annual pap smear or every 2 years, which can test for cervical cancer, or you can just go to the doctor and they can do other types of screening tools to test for cancer. Some symptoms of cancer. So these will all change depending on what area of the body that the cancer is in. So like I said, there's many different types, but some of the symptoms are fatigue. This is a very common one, is that you'll be very tired if you have cancer, or if you have cancer that is undiagnosed right away. You can have a lump or area of thickening that can be felt under the skin. So this is often where you can feel a hard mass of those cancerous cells clumped together. And this is often one of the times and signs and symptoms that patients find that they then go to the doctor and have it diagnosed as cancer. So if you are ever looking at a loved one or yourself and you can feel a hard lump, I would definitely recommend getting that checked out to make sure that it's not cancerous. You can have weight changes, which can be unintentional weight loss or weight gain. You can see skin changes such as yellowing, darkening, or redness of the skin. So make sure to be paying attention to your skin texture and then also the color. You can have sores that don't heal or changes to moles. So with that, the moles is oftentimes skin cancer. You can find a mole anywhere in your body, and you want to make sure that it's not changing size or color over time. Lastly, you can have changes in bowel or bladder habits. So this can be caused by many different types of cancer. You can have persistent coughing or breathing, difficulty swallowing, which could be any type of throat cancer, hoarseness, indigestion or discomfort after eating, muscle pain or joint pain that's unexplained, fevers or night sweats, and then lastly, unexplained bleeding or bruising. This is a sign and a symptom of cancer that you want to watch out for to make sure that you're staying healthy. Now we're going to switch over and talk about folate and the background information about folate. So folate is also known as vitamin B9. You may have heard of this from your doctor or just from any ads you've seen on television or any news articles. And folate is really important for red blood cell formation and for keeping healthy cell growth and function among those cells. Folate is also crucial during early pregnancy to reduce the risk of birth defects of the brain and the spine. So I'm sure that everyone here has heard of neural tube defects, and folate is actually one of the main things that a person can do while they're trying to get pregnant or they're sexually active and could become pregnant, because it is really important in the beginning stages of human development for the baby to make sure that they form correctly. So on the right here, you can see a folate supplement that patients should be taking, or you or any partner or anyone should be taking if there is a chance that they could become pregnant. And just one tablet a day can be extremely beneficial and should be easy to work into your daily routine. Lastly, as I talked about before, the folic acid and the birth defects, you should take 400 to 1,000 mcgs of folic acid a day if you can become pregnant. So as you can see, that folate supplement is 1,333 mcgs. So that definitely meets the needs if you are trying to get pregnant or could get pregnant. And this is also, folate is found, the supplements can be found at any store. So Walmart or Target, you can find it to buy it. Just one tablet a day can really be beneficial. So let's talk about some of the functions of folate. So as I discussed earlier, it helps your cells grow and multiply, helps form red blood cells. So as we talked about before, it's really important for the growth of these red blood cells and for the birth. It can help our genetic material, help it form. So this is such as your DNA and RNA, and you probably have heard about DNA before. It's in your body. It keeps your brain and nervous system healthy. It's really important for some of those aspects. It helps during pregnancy and infancy. And then lastly, folate helps balance levels of homocysteine in the blood. So this is something that's in the blood that has a vital just aspect in many different things. So that's why folate is super important to just keep everything working healthy, and it has multiple different roles in the body. So you may be thinking, okay, so should I take folate if I am possibly trying to get pregnant or could become pregnant? And the answer is yes, but also it depends. So before taking any supplements, it's always really important to talk to your primary care physician and make sure that you are cleared to take it, because folate supplements can interact with several medications. And you can see below that it can interact with multiple different things. So if you're taking methotrexate or any of the generic name brands for that, you should check with your doctor, because it can interfere with it. So a drug interaction is one medication or supplement can interact with another one and cause adverse health effects, or, as you might know, negative health effects. So it's always important to talk to a doctor. It also can interact with any anti-epileptic or anti-seizure medications. And then lastly, if you have ulcerative colitis, you may want to check with your doctor before taking folate, as it could cause a deficiency in folate if you're taking a sulfasalazine, which is for treatment of UC or ulcerative colitis. So before taking folate, you should check with your doctor to make sure that it is okay to take it and that you're not going to have any negative interactions between drugs in your body. But generally, folate is pretty safe to have as a supplement, but I'm going to talk about in future slides, if you don't want to take a supplement, how you can get it naturally through foods. So some of the folate foods that we have are dark green leafy vegetables. So this would be such as spinach or kale or broccoli, beans, peas, nuts, and oranges. So now we're moving on to fruits. Oranges are very good and very high in folate, so I'd recommend that. You could also try an orange juice if you're not a big fan of oranges themselves. Lemons, bananas, melons, and then strawberries lastly. So these are some of the foods that it's higher in, but you can also find folate in some of those meat products such as beef, chicken, or any type of poultry that you enjoy eating. So next, after talking about the importance of folate and what it does in the body and just where you can find it from the previous slide, you may be thinking, okay, Megan, how much do I actually need though of folate to reach those levels for those positive health effects? And the answer to that is 400 micrograms a day. So 400 micrograms a day may seem like a lot, considering the fact that that's how much is in a supplement, and supplements normally have higher levels, but it's actually not that much. So for example, if you're eating a normal just American diet, 1 cup of spinach has 58 micrograms. And that is 1 cup. Typically, if you're having like a spinach salad, you have more than 1 cup of spinach. And another example would be a tortilla. That's 64, which if you're having, say, tacos, you have some corn tortillas. So you have 2 of them, for example, with some spinach on top. That already almost meets that's half of your daily need for that right there. A cup of broccoli is 78 micrograms a day, or just 78 in general, which is pretty high. That's almost 1/4 for the day. A bagel is 114 micrograms, which is very, very high. That's because sometimes the bread and enriched flour is enriched in folate through the processing. And then one of the highest foods that I did not know about before this was that 1 cup of black beans itself is 256 micrograms. That is almost 3/4 of your needs for the day. So if you think about it, just looking at the chart here and all the information I give you, if you had 1 cup of spinach on your taco with 2 corn tortillas and a cup of black beans for a taco, a little taco bowl, or just tacos in general, you could meet all of your needs just from that one meal. And most likely you're not going to be eating like that. So you can spread it throughout the day with various different foods. Next, I'm going to talk about just the link between folate and cancer. So a folate deficiency is linked with breast and colon cancer, unfortunately. And the actual idea of whether or not to supplement folic acid and folate is very controversial and complex because they have found that folate supplementation may prevent uncontrolled cell division initiation, so the start of cancer. However, though, if you already have skin that is cancerous, such as a lump that you have undiagnosed, it can actually make it progress faster if you're having too much folate. So it's kind of you have to find a happy medium between the amount of folate you're having and cancer prevention. But I'm going to talk a little bit more about how to determine how much you should be having based on if you have cancerous cells in your body, if you have cancer, or if you are just generally healthy. So the real world importance is that if you are a cancer patient, you should avoid the supplementation of folate as it could be causing your cells to grow and divide uncontrollably even more than it already is. And obviously, when you had cancer, we talked about how those cells are just dividing as much as possible uncontrolled. So you want to avoid folic acid supplementation. Additionally, if you are a predisposed and susceptible individual for developing cancer, so maybe you have a lot of risk factors for developing cancer, or you have a history of cancer in your family, you should also avoid supplementing with folic acid. And folic acid should also not be recommended for those who are over the age of 50. And this is because individuals over the age of 50 that have a high intake of folic acid are often associated with having a high presence of precursors of lesions of cancer. So those clumps already. So you don't want to be continuing to have a high intake of folate when that could cause that to start dividing uncontrollably as well. So let's talk about just some lifestyle recommendations that I would recommend. So the first one would be to meet your folate needs. And this would be to meet those folate needs, the 400 mcg a day for a healthy, normal individual from dietary sources instead of synthetic folic acid. So instead of taking that supplement, I would recommend you getting your folate from natural sources, such as those meat products we talked about, or some of the oranges and the beans, tortillas. You can get it from those fruits and vegetables, the dark green leafy ones, such as spinach. It's always better to try to meet your needs from natural food sources instead of going straight to supplementation. So if you are a general healthy human without cancer or without any of those predispositions to cancer, I would recommend meeting your needs from food alone before supplementing. So if you do have cancer, you want to be extremely cautious about having high levels of folate in your diet or through supplementation. So I would recommend to really make sure to talk to your doctor about what your level should be and how much you should actually have in a day to make sure that you're avoiding anything that could cause your cells to divide even faster than they already are. And also that you make sure that there's no drug interactions. The drug interaction part is extremely important too. Before you ever consider having supplementations of folate, because you can't meet your needs from your diet, you should talk to your doctor just to make sure there's no interactions, and also that you're not a population or a person who may be having any negative effects with this. So as we've gone through this presentation, we have talked about what folate is, what cancer is, and then the effects between the two. And overall, you learned that you should be meeting your folic acid needs through food sources. But however, if you cannot meet those needs, or if you are possibly trying to become pregnant or could accidentally become pregnant, you should really make sure to have your folate intake through supplementation as well, just to make sure that you decrease the risk of any negative side effects. And we've also talked about how folate deficiencies are linked to cancer. So it is important to meet those needs, whether it be through dietary means or through supplementation. As you can see here, this information was given to me through Mayo Clinic. I used 2 different sites for that. And then also we talked about some of those higher folate foods, such as the beans and everything. That was from a different link. But thank you guys for listening about folate, and I hope that you consider to start implementing a higher folate diet to prevent cancer, or if you have cancer, to talk to your doctor and consider doing a lower folate diet. Thank you.